Are you wondering if cardiology pharmacy is the right career path for you? Is it something that'll make your heart pitter-patter with excitement? Or is it something that you wouldn't love at all? In this video, we'll be talking all about their salary, satisfaction, the flexibility and demand in this very niche pharmacy job market, and all of the details. If you're new here, welcome! I'm Alex, the founder and CEO of the Happy PharmD. We're a career coach company that helps pharmacists discover and get into jobs that they love. We've done a lot of these career paths. You can check them out in the description. And we would love it if you subscribe or leave a comment about what career path you'd like to see us talk about next. So with that, let's jump into it. What is cardiology pharmacy? Well, it's all about the heart. The heart pumps like 100,000 times in a day through 60,000 miles worth of blood vessel. It's pretty important. And in the study and practice of cardiology, it's all about the heart health and how it interacts with the rest of the body. Cardiology pharmacists, it's not at all really about dispensing medicines. It's more about understanding the problems that are going on with the heart, from hypertension to heart attacks, and being able to help usually within the hospital pharmacy setting. Occasionally there's a few cardiology pharmacists in ambulatory care clinics, but usually it's because it's within a health system that has that, but majority of these pharmacists practice in hospital settings. There aren't any official numbers to the amount of pharmacists practicing in this sector, but we do know that according to the Board of Specialty Pharmacists, there are approximately just under 700 pharmacists with this certification. By comparison, there's over 330,000 pharmacists practicing in the United States. We're talking about a niche within a niche within a niche. The job titles typically are something like clinical pharmacy specialist, cardiology pharmacist, cardiology clinical pharmacy specialist, or some combination of that. Typically, the way pharmacists get into this specialty is by doing a residency, typically a PGY2, and then getting experience within the hospital setting. And that usually takes years and years. Vast majority of people do a residency. All right, let's talk about salary. What do cardiology pharmacists make? Well, you're not going to really find a whole lot of difference between cardiology and other specialties, although it does depend, of course, based upon location and experience. According to salary.com, the average cardiology pharmacist makes between $127 and $143 annually. It's a decent amount. Meanwhile, ZipRecruiter puts that average a little bit lower at $126. A recent job we looked at in Fort Wayne, Indiana, showed a $125 offering salary. So essentially what I want to point out here is that as a cardiology pharmacist, you're likely not going to be making significantly more starting off than your clinical pharmacists or even your hospital or retail counterparts. Personally, I hate the idea that you go through extra training, 2 years typically, in order to get into this field, and the experience is not valued more than, say, a generalist clinical pharmacist or even a hospital pharmacist. And I'm not trying to downplay those roles. I'm just saying, like, what is this? If you look at any specialty within physicians, practically every other specialty is paid more than a general practitioner within family medicine. It's because it takes more training, time, and expertise for those specialties. Why aren't cardiology pharmacists paid more? I think it's because right now specialty pharmacies aren't really seeing a market value increase in terms of value. And so these hospital pharmacy jobs are not offering more money for the training provided because either one, they don't see the value in these positions as much as what's different than what's out there. The return on investment for cardiology pharmacists isn't any different than a generalist clinical pharmacist. 3, it's potentially because we're not good as a profession at highlighting our value, and I think that that could be playing a role here. In addition to this is also the factor of like fulfillment. I also think there's this intangible factor when it comes to salary and fulfillment. I've seen it over and over again where pharmacists who are highly trained be willing to do jobs for less money, but it's more fulfilling. And the companies know this, so they're willing to offer them less. I don't have document proof or research. It's a theory I've been building over the years. Given all of these factors, and the main one being that for all this additional training to do this job, you don't get paid more, if not even less in some circumstances, I'm gonna give the salary score a 6 out of 10. Let's talk about satisfaction. Are you curious about, is this role more fulfilling or different than the other jobs that are out there? Well, let's get to the heart of the matter. Okay. There doesn't exist a single study that looks at job satisfaction within this very specific niche of cardiology. But what we do know about clinical pharmacy is that in general, they tend to be more satisfied by their jobs than their non-clinical counterparts. One study found that clinical pharmacists generally experience higher job satisfaction than staff pharmacists in terms of professional interaction and personal outlook. However, a recent study done in March 2023 found that clinical pharmacists exhibit low satisfaction with the recognition currently provided. And the study also found high rates of dissatisfaction and the time allocated to do various activities like their clinical work, quality improvement, and research and scholarship. In general, what I found to be true about clinical pharmacy is that around the 6 to 9 year mark, people tend to burn out. They've been pushing themselves for so long, they've kept up their same work ethic since residency, and they get tired of the grind. That's just a matter of, I think, the system and how it works. And a lot of these cardiology pharmacists go into other fields. They go into research, academia, pharmaceutical companies to get out of that grind. Now, some people love it and some people dislike it. We also know that from various studies that clinical pharmacists in general have a burnout rate somewhere in the vicinity of 55 to 75%. This is true from multiple institutions, multiple hospitals, different settings. And so you have to take that into account when considering almost any career path. However, the same is almost true for a lot of other various settings like community and hospital settings. If you want to look for anecdotal evidence, some people on Reddit have commented on how cardiology is something that they find really fulfilling. A couple of pharmacists have pointed to the idea that there's two really great aspects of this. One is patient interaction and exposure to solving problems immediately for people. Since it's cardiology, the heart is the living, beating engine of our bodies, and they get the ability to manipulate it to make a solution happen relatively quickly. They also get to interact with a lot of other healthcare professions, getting to take care of that patient and seeing the immediate benefit. One pharmacist shared, "I love my job. I'm so happy I ended up with cardiology." And another shared, "I feel like I made the right choice by doing a PGY2 in cardiology." In the satisfaction section, we like to see what employees say about the company they're working for. And while many cardiology pharmacists are not rating the places where they work, others are. So some major hospitals that you probably have heard of, like Yale New Haven has a 3.6, Birmingham and Women's Hospital has a 3.8, and Nebraska Medicine has a 3.7. The same could be true, though, for a lot of other hospitals. If you're not aware of hospital institutions, especially in smaller ones, many of them are at risk for closing. Many of them have a lot of financial constraints, budget constraints, staffing constraints. And so there are lots of things that can stress these pharmacists out, from limited time to working with patients to limited support. But given that this is a highly specialized field and that frankly, you have to pass through typically vigorous training in order to get into the field. And by then, you should kind of have a feel about whether or not you really like this or not. And those that are in it seem to enjoy it overall, even though there is a higher risk for burnout. I'm going to give the satisfaction score a 7 out of 10. How in demand are these jobs? So if you're considering this field, what's job security like? Is there going to be a ton of openings available? And well, in our research, while there aren't a lot of these jobs, there is not a lot of competition. Cardiology, like other specialized clinical pharmacy practices, continues to be a field within where recruiters are actively used to find new specialists. Why? because once a specialist gets a job, they typically tend to stay at that institution. It is hard to recruit for these positions because there aren't a lot of specialists in this field. When looking at Indeed.com, we found that there was about 160 jobs available, and 120 of those were entry level. So about 75% of those were entry level positions. Meanwhile, on ZipRecruiter, we found there was over 260 jobs that were available. I tend to think that ZipRecruiter is better at finding specialist jobs. I think the demand for specialists will continue to grow over time, as it's very evident that the market kind of created out of nothing over the last 20 to 30 years. 30 years ago, there weren't a whole lot of jobs available for cardiology pharmacists. There wasn't a PGY2 program out there for cardiology. Now there are over 100 different PGY2 cardiology programs that exist. One study was looking at the impact of having a cardiology pharmacist on their team and found all sorts of added benefits, better safety, better outcomes, better return on investment. And this reflects the growing number of demand for cardiology pharmacists. Bonuses are back for cardiology. They're not as high as they are in typical community retail settings, but they're there. And it highlights the idea that these are hard to fill positions. In research for this, we looked at LinkedIn to see how many people were applying to these cardiology jobs. And as we'll show you, it's only a handful of people are applying to these open positions. Competition is at an all-time low. Given all these factors and that it's such a small industry and yet so many hard to fill positions, I'm going to give this score a 7 out of 10. And now for the final factor, flexibility. This is the magic sauce, the thing that allows people to be flexible within this career. Let's dive into some specifics. In terms of schedule and how you'll be working as a cardiology pharmacist, it widely varies. But in general, we found that these positions can be within normal standard operating hours, 9 to 5 kind of shifts. However, there were also a lot of positions that were 10 and 12-hour shifts, as well as those that required weekend work and even on-call demand. I don't know about you, but being on call was awful. I never liked it. So you have to take that with a little bit of a grain of bitter salt. There also are new roles coming out for cardiology that are remote. Hey, I love that. However, this is not the norm for cardiology. Cardiology pharmacists tend to enjoy quite a bit of autonomy. After all, when you get into a hospital, very rarely, unless it's a major institution, will they have another cardiology pharmacist on staff. The vast majority of hospitals in the United States do not have a cardiology pharmacist. So you get to operate your clinic, your work, the way you see fit. In addition to that, this career path also tends to enjoy a lot of flexibility for what you'd want to get into next. You could easily become a professor within a college of pharmacy or even within different colleges of medicine. You can also get into research or even get into the illustrious pharma career path. There's a lot of settings that you could be practicing in. The typical ones are going to be hospital and health systems, but cardiology pharmacists could transition within ambulatory care, academia, managed care, pharmaceutical industry companies, and even specialty pharmacy, although that's kind of rare. Given these factors, I'm going to give this a solid 7 out of 10. You're probably seeing a theme here. Let's give cardiology a final score. So breaking this down, for the salary, I said that it's kind of competitive, but not much better than any other kind of job. Still 6 figures, which is of course nice. And I gave it a 6 out of 10. The satisfaction score was a 7 out of 10, and that's mainly because of the high rate of burnout that people see over time. However, many pharmacists practicing in this field report high levels of clinical and interprofessional satisfaction. For the demand, I gave it a 7 out of 10 because these are hard to fill positions. However, there's not many of them. And then finally, for flexibility, I gave it a 7 out of 10 because you could specialize and go in different areas from pharma to academia and different practice settings. But there's a chance that some of these jobs will be not 9 to 5 schedules and often can be weekends or even on call. And so with careful consideration and getting in touch with my feelings and my heart, I decided to give this score a 7 out of 10. I think it's interesting that such a niche even exists within pharmacy. It's highly specialized. There aren't a lot of people that go in this route. I feel like how this route kind of gets started is you do some sort of internal medicine rotation as a PGY1. You tend to get really interested in things of the heart. You tend to have a great interaction with the cardiologist while on residency. And you're like, I think I could do this. I think I could be a cardiology pharmacist. So they go into the PGY2, and then they either get a job offer immediately from the company that they got the training from, or they have to go search elsewhere. The market is not saturated. So few people applying to these jobs. It's very hard to recruit for these jobs. And so, it's you kind of get to pick wherever you want to work. It's a decent role if you think you can nerd out on the heart for the next 10, 20, 30 years of your career. And I don't think you're stuck forever working as a clinician in this career. So what do you think? Are you interested in cardiology pharmacy? Was I too harsh on this career, or was I not generous enough? I don't know. Let me hear your thoughts. This is a career path which very few people interact with, but we thought it important to go over in this video. Thank you for watching this. Let us know what you want to go over next as far as career paths. And until we see you in the next episode, take care.